Welcome to Good Doctor. It's me again, Shani, your friendly pharmacist. After we talked about the types of insulin in my previous video, now let me show you the proper way of injecting insulin using different devices. But if you missed this topic, you may click the link below and learn from it. Let's proceed on how to use insulin pen and pre-filled syringes. You first want to make sure that your hands are clean. Then get your supplies ready. And what you'll need is a vial of insulin, alcohol swabs or rubbing alcohol with cotton balls, a specific syringe that is meant for insulin use. They are different sizes of insulin syringe according to the prescribed units given by your doctor. This syringe holds 50 units. So depending on the units you want to take, you want to make sure you have the right size for your insulin syringe.
God, please, no! No! No!
Then if you're using a cloudy insulin, make sure that it's mixed well. Here's actually a good way of doing that by turning the bottle sideways and gently roll it back and forth a few times to again make sure that it's evenly mixed. Refrain from shaking the bottle to avoid forming bubbles inside of it and to keep from withdrawing bubbles on your syringe. So now get your alcohol swab and wipe up the top of the vial and take off the two caps of your syringe. One is for the cover of the plunger and the other cap is for the needle. Your next step, and a very important step, is to draw air into the syringe that matches the amount of insulin that you're going to take. So let's practice with 15 units. I use the tip of the plunger to align the mark that says 15. Get your vial and gently push down the needle, then push the plunger to release all the air from the syringe. Again, this will help you to easily draw your insulin from the bottle. Then at this point, you have to turn your bottle upside down and somewhat hold the vial with your one hand. So you have this hand free to pull back the plunger. Now if you notice that you're pulling air bubbles into your syringe, just give it a good push back into the vial and that usually clears any air. But if you continue to pull air, again, continue to do that step until, as you pull it slowly out, you don't see any air bubbles in the syringe. Air bubbles take up space. They're not gonna hurt you, but you wouldn't get the right amount of insulin. So now, if you don't see any air bubbles in your syringe and align the tip of your plunger on your required units, you can pull your needle out and this will seal itself. Now, you're ready for your injection. Typically, for best absorption, the abdomen is the best place to choose. Get your alcohol swab and wipe the site of injection. You can pinch a fold of your skin and otherwise, it's not necessary. Take your needle and go straight in. And slowly push the plunger until the insulin goes in. And wait at least 5 to 10 seconds before you pull your needle out, so that you'll allow the insulin to absorb.
Wait for it. Here it comes. Almost there.
After that 10 seconds, pull it straight out. If you notice a little bleeding on the site, just apply a little pressure. You don't want to rub it vigorously because that might cause the insulin to absorb faster rather than what it's meant to. For the disposal of needle, don't mind putting back the cup. Just throw it directly on your sharps labeled container. Or if you're going to make your own, it's recommended to have a heavy plastic container with a screw cap and then label it with sharps. And there are certain sharps collection stations that you can drop it off after once it's filled up. For the insulin pen, this is easier to use rather than the syringe. We have the insulin reservoir, which contains all the insulin, rubber stopper, which where you attach your needle, a dosing window, which shows you how many units of insulin you'll be needing, dosing dial that you use to adjust to move the dosing window, and the injection button, where you push the button to release the insulin on your body. Then get your supplies ready. Your insulin pen, alcohol swabs or rubbing alcohol with cotton balls, and your needle. Remember that pen needles are one-time use only. So every time you inject insulin, you should use a fresh pen needle. Remove the cap of your insulin pen, get your alcohol swab, and wipe the rubber stopper at the tip of the pen. Next, we're gonna connect the pen needle. To do this, peel off the paper tab. Then place the needle straight onto the pen and twist the needle pen. It doesn't have to be overly tight, just secure. The next step is to remove the two safety cap of the needle. Set aside the larger clear cap for proper disposal later and the inner shield that can be thrown out. The next step is a very important step. It's to perform a test shot to make sure there are no blockages to the flow of insulin and to remove potential air from the tip of the needle. To do this, turn the dosing dial on the pen until it says 2 on the dosing window. Next, hold the pen with the needle pointing straight out. If you see an air bubble in the insulin reservoir, gently tap the pen until the bubbles move to the top. Next, press the dosing button. You should see a few drops appear on the tip of your needle. You may notice that only even numbers appear, but each line represents 1 unit. So for example, your dose is 5 units. The line that you'll select is between 4 and 6. Once you've performed your test shot, you can now proceed on injecting your dose. Again, turn the dosing dial on your desired or prescribed dose until it shows on the dosing window. Once you select the right amount to give, clean the area where you're going to inject. When injecting insulin, it's important to remember that injection sites should be rotated, meaning pick a different site every time. Not rotating properly can result in changes to the skin, which can impact insulin absorption. Insert the pen needle at a 90-degree angle. Once the needle is fully injected, press the dosing button down and wait for at least 10 seconds before removing the needle to make sure the insulin is fully delivered. When you're done, it's time to remove the needle. Place the large cap back onto the needle and untwist the needle until it's completely removed from the pen. For disposal, just throw it directly on your Sharps labeled container. Finally, put back the insulin cover and store it in a cool, dry place. And for more advanced type of device that most diabetic patients use right now are the insulin pumps. It is a small programmable insulin delivery system powered by a battery that delivers rapid-acting insulin 24 hours a day. This eliminates the need for multiple daily injection. The parts of the insulin pump are the computerized pump, which is programmed to meet your specific insulin requirements once you determine your blood sugar level using a blood glucose meter, a reservoir to hold the insulin, and an infusion set that delivers the insulin from the pump through tubing and into the body through a small, thin plastic tube called a cannula. Once placed, you can easily disconnect the infusion set for activities like showering, then reconnect when finished. Every 2 to 3 days, new insulin is added to the pump and the infusion set is changed. You can do this from the comfort of your own home when a change is needed. No hospitalization or help from a healthcare provider is required. You can also program the pump to deliver a large amount of insulin right before eating to cover the amount of carbohydrates you're about to eat. To wear insulin pump, you can simply put it in your pocket or clip it to any piece of your clothing. With your pumps, you always have your insulin with you when you need it, instead of forgetting it at home. This helps you to avoid risk and manage your sugar properly. With your improved insulin devices, you can spend more time enjoying a flexible lifestyle and less time managing your diabetes. If you learned through this video, please like, share, and hit the notification button for more updated videos. See you next time!